Hello, I am Dr. Rakesh Sarkar, Senior Consultant Cardiologist and Electrophysiologist in Birla Heart Research Center. Today I am going to speak on pacemaker in atrial fibrillation. So pacemaker is something which requires in a situation when patient doesn't generate adequate heart beating or adequate electrical impulse to go for the heart beating. Now atrial fibrillation, as most of the people know, that is a situation or a condition when the upper chamber of the heart or the atrium continues to pace at a very fast heart rate, whereas the lower chamber or the ventricles may have the reflection of the fast heart rate or may not. Now this is a very funny and little paradoxical situation where we are dealing with the pacemaker and atrial fibrillation, as we have the common perception that the person with atrial fibrillation should have fast heart rate, so why we need the pacemaker? Now it is not mandatory or essential to have very fast heart rate in all the patients of atrial fibrillation, because that person might have some problem with the connection between the upper and lower chamber of the heart, which is called AV node, and the disease of the AV node may result into the very low heart rate of the ventricles, which may require pacemaker, which is often ignored and may be missed sometimes, feeling that atrial fibrillation doesn't require pacemaker all the time. Now the substrate of atrial fibrillation, if we understand, sometimes can be very much treatable rather with pacemaker, because sometimes we feel that the sick sinus people or the sick sinus disease patients tend to develop atrial fibrillation, which can be mitigated partially by atrial pacing maneuvers, and at that point of time we feel, as the point of view from an electrophysiologist, that atrial pacing sometimes may be very kind of reward for the atrial fibrillation patient if it is a kind of paroxysmal atrial fibrillation for sure. Now as a last point which I want to mention, in a patient of atrial fibrillation of persistent variety where you are not being able to treat the patient either with medical therapy or by radiofrequency ablation, so pacemaker can be the game changer in a way where you can actually do some radiofrequency ablation of the AV node, where you can actually disconnect the conduction between the upper chamber and the lower chamber of the heart, and at the same time you can ensure the very physiological paced rhythm in the lower chamber of the heart in the form of pacemaker, and that is considered to be the most recent application of conduction system pacing in the patient of persistent atrial fibrillation with uncontrolled ventricular rate, where you are not being able to control the ventricular rate at all. Thank you.